Did it start?
It did start.
Hi, this is Elizabeth Jones, and this is my HEENT assessment. My patient here, this is Kevin Goulet. Kevin, we are going to be posting this on the internet. Do I have your consent to post?
Yes.
Okay, wonderful. All right, well, we'll go ahead and get started. So, can you tell me a little bit about what brings you in today?
I'm coming in today for dry eyes.
Okay,
I've had them for about a month now.
okay,
I've been using eye drops, but it really isn't helping.
okay,
I'm still getting dry eyes throughout the day.
gotcha.
I'm using multiple eye drops during the day, so it's not really helping.
Okay, are they prescription eye drops or
No.
over the counter?
They're just over the counter.
Okay, are they like saline drops?
Saline by Bausch & Lomb. They're like in a little green bottle.
Okay, alrighty. So tell me a little bit more about this dry eye. How long, I know that you said that you've been having it for a couple weeks, but I mean, is this something new or have you experienced it before?
I've probably been really experiencing it for about 2 years.
Okay,
I thought maybe it was my computer screens. I probably should wear my glasses a little more.
okay,
I really don't. And I thought that sometime it was the lights, but it's never gotten any better.
okay.
So I just started using regular over-the-counter eye drops.
Okay, alrighty. Have you noticed, is it better or worse at certain times of the day or seasons?
No, it's pretty much all season, or all throughout the year. I start off by putting eye drops in my eyes, and by the time I get to work, I'm putting drops in my eyes again.
Oh, you mean so first thing in the morning?
Yes.
Okay, alright. About how many times a day would you say that you use your eye drops?
Between 5 and 6.
5 and 6?
Yes.
Okay. How does it seem to be working for you?
It helps at the moment. Then I start working, and then it's most of the time when I slow down and I finally realize that, my eyes are dry and I'm like scrubbing them or like itching them, or
Okay.
which I know is bad, seeing how I had LASIK back in 2009.
Oh my goodness, okay.
Yes.
LASIK's in 2009.
Yes.
Okay. And you said that you currently wear glasses?
I'm supposed to, yes.
Okay. All right. Well, tell me more about that.
I really don't wear them unless it's nighttime or my eyes are like majorly tired or I'm in front of a computer screen for a long period of time.
Okay. And what kind of work do you do?
I'm a medical assistant
Okay.
at Orthopedics.
All right. So I guess you spend a fair amount of time in front of the computer entering orders and such?
Yes, it depends on the day, but
Okay.
yeah.
All righty. Any family history of dry eyes or cataracts, glaucoma?
My mom and dad, I think, had cataract surgery. Both of them did,
Okay.
I think. Or glaucoma? No, has to be cataracts, yeah.
Okay.
They both wear glasses. My mom's had multiple eye surgeries.
Okay.
So,
Alrighty. So tell me, this dry eye, does it affect any of your activities or?
no,
Okay.
no.
All right.
More of an annoyance.
Okay. Do you participate in any sports?
I play racquetball.
Okay.
Yes,
All right. And I assume you wear eye protection?
I do. Safety glasses, yes.
Okay. Wonderful. Wonderful. So you already said that you had LASIK surgery. When was your last eye exam?
Last year.
Okay, 2024?
2024, yes.
Okay. All right. And how was that?
It was good. He did tell me that I brought that up to him, and he did tell me that I should probably get better eye drops, but I never followed through.
Okay. All righty. Is that something that you're open to? Maybe a prescription eye drop?
Yes.
Okay, wonderful. Let's do a quick review of your medications. I know that you take medication for your high blood pressure.
Amlodipine, yes.
Okay. And what else are you taking again?
I'm taking Trazodone,
Okay.
and I'm also taking Valtrex.
And Valtrex
Yes.
as well. Okay. Any? Do you take any type of antihistamine? Anything for allergies?
Usually not.
Usually not.
No.
Okay. All right. The only reason I ask is because antihistamines, specifically allergy medications, they can cause dry eye as
Okay.
well. Okay. Great. All right. Well, so then I think what we'll do is we'll give you a quick exam, and we'll see if we can't get your eyes feeling a little bit better then.
Excellent.
Okay.
Thank you.
Yeah, you're welcome. All right. So first, we're going to start. We're going to assess your hair and your head. So basically, what we're doing is we're looking at hair distribution, checking the texture of it. Then we're also going to go ahead and palpate your skull here, and what we're really doing is we're just checking for the shape of your head, checking for any trauma, any lesions, any growths that we normally wouldn't see. All right, so everything looks really good. All right, so then we're going to go ahead and move on to the actual eye exam itself. So normally we would start our eye exam with a Snellen eye exam. I'm not sure if you're familiar.
Yes, I am.
Unfortunately, in our office here, we don't have access to that. So what I'll do is I will verbalize what the exam is comprised of. So we would have our patient stand about 20 feet away from the eye chart. We would have you cover one of your eyes, and we would have you read from top to the bottom. We would have you read the letters and the numbers, going down each line until you are unable to read any further, and you would want to do that without straining your eyes. After that, we would have you uncover that eye, and we'd have you cover the other eye, and we would go through the process again. And so that's what the Snellen exam is. So before we move a little bit further, we're going to go ahead and just do a visual assessment of your eye itself. And what I'm looking at is I'm going to be looking at your sclera, which is the white part of our eyes. And then I'm also going to be looking at the iris, which is the colored part of your eye. We're also going to check the conjunctiva. And then I'll check that in just a minute, but we're also going to be looking at your cornea. Now, your cornea is it's like a clear film, so that isn't something that we would see, but you would see some cloudiness in the cornea area for somebody who might be developing cataracts. Okay, so as I was talking about the conjunctiva, what I'm going to do is I'm going to pull down your lower eyelid here. Okay, and so your conjunctiva is nice pink, so we would expect it to be pink or reddish pink, which yours are. Okay, so we are going to move into the rest of our eye examination. So what we're going to do is we're going to check your pupillary response. And the way we do that is we shine a light into your pupil. And what we're looking for is when I shine the light into your pupil, we're looking for it to constrict. And then I'm going to shine it in your pupil a second time, but I'll be looking at your pupil in the other eye. Okay? It's called direct and consensual. So we'll start here with your right eye. Okay, and we'll come on over here to your left eye. Perfect. All right. These things can be challenging sometimes. Okay. Next test that we're going to do is called our cardinal field of gaze. So what I would like you to do, without moving your head, only moving your eyes, I want you to follow my finger.
Mm-hmm.
All right? And then back to the midline. Perfect. All right. Now, keeping your head still, just following with your eyes, what I want you to do is keep an eye on my finger as I bring it in close to your nose. All right. Wonderful. Okay, so that was testing for convergence and accommodation. All right. All right. You did a great job. So I think what we're going to do is we're going to move on down your face and proceed with our exam. All right. So we're going to take a look at your nose. We're going to assess your nose. And what I'm looking at is I'm looking at the skin and at the texture and the color. I don't see any unusual growth. Your texture looks good. All right. So what I'm going to do, if you don't mind, is tilt your head back just a little bit. I'm going to examine each of your nares. Whoops. Can be a little tricky. I'm going to put my thumb here. All right. All right. So sorry. Oh. All right. Okay. Almost done. Okay. All right.
Sorry.
That's okay. So what we're looking for when we examine your nares is we are checking for any growths, any polyps, which we don't want to see. But we also can examine your turbinates, and we can also identify a deviated septum, which I didn't identify when I examined you. Okay. I did see that you have a little bit of clear discharge, so I don't know, is that something new for you?
No. Excuse me.
Okay, sure, no worries. Okay, so while we're here, I'm also going to take a moment and I'm going to examine your sinuses. So we're going to start right here. And these are your frontal sinuses right here, okay? And then I'm going to examine your maxillary sinuses right here. Are you having any pain?
No.
Okay. No pain?
No.
No pain.
No.
Okay, wonderful. Excellent. Alrighty. So, we're going to go ahead and we're going to get started with your ears. So as we always do, we're going to start with the inspection. So as I'm inspecting your ears, I am examining them for color and shape. Your ears are symmetric. I am looking at texture, at the color. I'm also going to tug a little bit here on your pinna and then also on the tragus. Are you having any pain when I do that?
No.
Okay. Just going to go ahead and palpate here. So I'm really feeling around just to see if you have any lumps or any bumps. All right, and you said no pain, correct?
No.
Okay, all right. So before we move on to the internal exam, we're going to do a couple of hearing tests, all right? So the first test is called the whisper test. And so what I'm going to do is I'm going to occlude one of your ears and then I'm going to whisper a 2-syllable word, okay? And then I want you to repeat what the word is. All right, so we'll go ahead and we'll start on this side here, on your left side. Baseball.
Baseball.
Okay, all right.
Apple.
Okay, wonderful, excellent. So the next test that we like to do is a test for hearing loss lateralization, all right? And this is actually called the Weber test. So unfortunately, we don't have the benefit of a tuning fork, but I will verbalize what the exam looks like. So essentially, with the tuning fork, we will go ahead and strike it on our bone, and it would vibrate. And then what we would do is we would set it either on the patient's forehead or on the top of their head.
Mm-hmm.
And we would ask them where they're hearing the noise. And ideally, they would say that they're hearing it in both of their ears. In the second test, which is called the RIN test, again, we do use a tuning fork. What we do is we strike the tuning fork, and then we place it behind a patient's ear on the mastoid bone. And then we ask the patient to tell us when they no longer hear the vibration. When they tell us that, then we go ahead and then we move it to the front of the ear. And so those tests help determine on if there is hearing loss and what kind of hearing loss it could be. Okay, do you have any questions about that?
Nope.
All right. Have you been having any difficulty with your hearing?
No.
Okay, all right. You don't wear hearing aids?
No.
Okay, fabulous. All right. So, we're going to move on to the internal exam. And then I just realized that we did not do your eye exam,
Okay.
your fundoscopic exam. So we'll go back and we'll get that in just a moment. All right. Oh, Lord. Okay. All right. So in adults, you pull the ear up and back. All right. So what we're looking for is we want to visualize the tympanic membrane. Color should be a pearly gray white, and the membrane itself should be intact. There should be no perforations on it. It will also give us an opportunity to identify the cone of light, which is a good reference in helping us identify some of the other internal structures that we hope to see. Okay? All right. Okay, so I'm seeing that I believe it's your cone of light, and it looks like that's at maybe 5 o'clock. I'm seeing a little bit of ceremonious buildup, which is just wax buildup, but we can go ahead and take care of that with a flush. Okay, all right. So we're going to go ahead and check your other ear here. You doing all right?
I'm doing great.
Okay. Whoops. Oh, yeah. Okay, everything looks good inside there. Okay. So, as I said, I skipped a portion of our exam. It's called the fundoscopic eye exam. So what we're going to do is we're going to examine each of your eyes. So we look through the pupil, and what we're going to be looking at is your retina. We're going to look at a part of the anatomy. It's called your disc cup. One of the reasons that we focus on that in particular is to see if there's any papillary edema, which is not a good thing. go. There's a red reflex, okay. I'm gonna go in just a little bit closer here. All right, so I can see your disc. It's like a pinkish orange. All right. You okay?
Yeah, I'm
No,
fine.
I know. That's a tough one.
Yeah.
That's a tough one. Okay. Oh yeah. Okay. All right. Okay. So eyes look fine. So some of the things that we do look for when we're examining when we're doing the fundoscopic eye exam, we want to look at any veins and any arteries, which you do have veins and arteries in your eyes. And of course, we're looking at the fundus. We're looking at the retina. I did not see any papillary edema, so your eyes look really good.
Thank you.
Okay, yeah, you're very welcome. Okay, so we've done your ears. All right, so moving down, we're gonna examine your mouth. So I'm just gonna go ahead and assess your lips. So I'm looking for color, for moisture. If the skin is intact, I can see that the skin is intact. What I'm going to do next is I am going to check your buccal mucosa. So what I'm going to do is I'm going to have you pull your lip down just a little bit. There you go. All right. That's perfect. That's fine. You can go ahead and let it go. So it's pink and it's moist. I'm not seeing any lesions on there, which is good. Okay. So also going to go ahead and check your dentition. So there you go. All right. So yeah, just checking to make sure if you have dentures. I know you don't. I know those are your natural teeth. But you know, we're checking to see if there are missing teeth, if there are teeth that are broken or damaged that might need to be addressed. Also, what we're going to do is we're going to check your gingiva. Okay, so I'm just going to go ahead and pull your lip up here a little bit. Okay, so it looks great. It's pink, it's moist. I'm not seeing any white lesions on there, which is good. We hope to not find any of that. So what I'm going to ask you to do next is I want you to say ah, but I don't want you to put your tongue out, okay? Oh, Lord. Okay. Okay. All right. Perfect. Okay, that's great. So what I'm looking at is I'm looking at your posterior pharynx, the back of your throat, and also visualizing your uvula and your tonsils. And what we're assessing for is any erythema or any exudate. Good news is I did not see either of those. In regard to your uvula, we're just checking to make sure that it's midline, and yours is. Also, for your tonsils, again, no erythema, no exudate, no indication of tonsil stones that we could see. Okay? All right. Let's see. All right. So next we're going to check your lymph nodes.
Mm-hmm.
All right. So we're going to start right up here in front of your ears. These are your pre-auricular. Behind your ear, we've got your post-auricular. We've got tonsillar. We've got submandibular. We have submental here. We have anterior cervical. And then we've got your posterior cervical. And then we also have your, oh Lord, it escapes me. substernal. Nope, not substernal. Well, you have some right here. And then lastly, you have occipital, and these are found at the base of your occiput. Okay. So something else that we also check during these exams is we check your trachea, and then we also are going to check your thyroid. Okay.
Mhm.
So what we're going to do to check your trachea, what we're really looking for is to see if it's midline. So I can visualize it, and it does appear to be midline. But one way to check it is we can put one finger on the side here and push it over, and then the other one to the side, push it over, and it returns to the midline. So your trachea is midline. There's no deviation. All right. Checking your thyroid, there are two ways to check your thyroid. We can check it from the front, or we can check it posteriorly. So I'm actually going to check yours posteriorly. So I'm going to come behind you here. All right. Let's go ahead and turn this around here. All right. All right. Fingers on each side. Okay. And you can either have your patient take a sip of water and swallow, or just swallow. Okay. All right. So I can see that when you swallowed, your isthmus did rise, your thyroid did rise, and then it returned. So that's perfect. That's exactly what it's supposed to do. Okay. Mr. Goulet, everything seems to be in pretty good order. We'll see what we can do about getting you something for those dry eyes. Do you have any questions for me?
No, I don't. Thank you.
Okay. All right. Well, thanks so much.